I was 12 years old. I went to the orthodontist. I had my braces, and every time I would go to the orthodontist, he had a really nice watch. He had beautiful women working in his office, which I appreciate as a 12-year-old. As a 12-year-old, I was like, that's what I want to be. I want to be an orthodontist. It was scary, and we're never trained in that. We didn't really get that business or entrepreneurial education, so it was a huge learning curve, but it was fascinating. I learned so much that first year, and I'm still learning a lot every day, but I think that I've grown a lot from it. It was worth all the stress.
Anything you would have done different?
I would have done it sooner. Other than that, I've been really happy with the decisions. It's really difficult because for me, I want to be there as much as possible with the kids, but there's a conflict there between seeing them personally and giving a lot of time and having the ability to establish that. I'm a kick back when you say like that.
Welcome back to Beauty Unveiled. I am Dr. Angela Sturm, and today I have with me the illustrious David Alfi. He is an oral maxillofacial surgeon, originally from LA, and went to Columbia in New York for his training, and then somehow found his way down to Houston, and is still here. So
13 years later.
Yeah, Houston does that.
It does. It's a great place to land.
It really is. It's a good place to live and kids. So tell us, first of all, like what you are and what you do, because I think it's super interesting, and I don't know that everybody understands what it is
definitely.
that I said.
It's I'm an oral and maxillofacial surgeon. We say oral surgeon, but I specialize in mostly orthognathic surgery, or double jaw surgery is what people know it as. I used to be full scope, meaning I used to take out a lot of wisdom teeth, put implants, do bone grafting, pathology, trauma, but I've, over the last decade, narrowed in where now it's almost exclusively jaw surgery.
Nice. And it's amazing. Like those transformations are incredible. So tell us, like, what in simplest terms, like what does that mean and who does that work for?
Yeah. So what it means is, patients with underbites, overbites, asymmetries, or there's this epidemic we can talk about where most people have small jaws. Their jaws, even if they're matched, they're together, they're too small for the tongue and airway, and they develop sleep apnea. So it's actually a huge part of the population that can benefit from jaw surgery, and it's becoming more of an accessible treatment to correct a lot of these things. But in essence, we're breaking the upper jaw controlled surgically and lower jaw very delicately. And then moving them to a more ideal position for better harmony, but more importantly, function.
Yeah. So I've heard a little bit about this. So I'd love your take on that, like small jaw and the OSA, and because I feel like you said, we see it more and more. And so what do you feel like is the cause? Tell me about that.
Yeah, it's interesting because I've gone into this rabbit hole, obviously being in this space. But it really starts if you look at skulls for the history of human, and you look at skulls 500 plus years ago for thousands of years, and this stuff's been studied everywhere around the world, and consistently jaws were much larger 500 plus years ago than they are today, and they've been getting progressively smaller in the sense that there used to be room for wisdom teeth. People had room for 32 teeth. They were straight. They had wider palates, larger jaws, and over the years, and I think there are environmental factors that made this happen. Now everybody needs their wisdom teeth out. Now everybody's teeth are crowded and can benefit from braces. A lot of people have nasal breathing issues, get septoplasties and turbinectomies. And really it comes from this shrinking of the jaws, which is the house for the tongue, and also the floor of the nasal anatomy, the turbinates and septums.
So you think it's just evolution, or you think that, you get on social media and people are like, it's because we don't eat this or that, Yeah,
I think it's multifactorial. I think the chewing, there's evidence for it. Like if you look at that time period 500 years ago and 200 years ago is really like when agriculture took off and people really went from hunting, gathering, and eating more foods to more rice and all these things. There was a clear change in the skulls. And then if you go to the industrialized 200 years ago or 100 years ago where everything started to become processed and packaged. And I think the introduction of formula milk for infants and the lack of dependency on breastfeeding had to be for many years of history. I think that may have a factor in it. And then I also theorize that nasal or allergies, not just nasal allergies, but allergies have skyrocketed. Yeah. And I think that's environmental. I think it has to do with introduction of antibiotics in our foods and environment. And the essence that there's so much antibiotic exposure now as a result of the markets.
Right. You have a cold and the expectations you get antibiotics.
Yeah. You get antibiotics, or any kid with a fever, any infant with a fever is going to get antibiotics. Right. Pregnant women are going to get antibiotics and to introduce it to the child. And then our foods, crops are sprayed, animals are given antibiotics. So it's everywhere. And, if it's introduced to infants or during an important part of gut development, I think it changes the gut flora. These are my theories. And that's why I think that, and the gut flora is so important development for the immunology.
Right.
But, when we were young, nobody had an EpiPen.
No.
We had peanuts on the plane.
Oh, yeah.
And now, my son has to carry an EpiPen with him, and there's no way that you'll see peanuts on a plane anymore. But it's just the fact that people are more allergic. But the issue with allergies is your nose will get congested. Right. And then you'll have to mouth breathe. And we know that mouth breathing changes the face for the worse.
Right, exactly. I think it's interesting to me that there's such a debate about doing septoplasty in kids, but then they'll mouth breathe their whole life and their whole face changes. So you're like, correct. Well, it's going to change. Right. Do we help it change better or worse?
Yeah, exactly.
The thought's kind of changing on our end as far as septoplasty. People are getting more understanding and being more aggressive with it.
Yeah, I think what I'm saying right now sounded probably a lot more controversial a year or two ago.
I think people are accepting that.
And people are accepting that.
It makes sense.
Yeah.
So what got you interested initially in dentistry and oral surgery and
the true story?
Yeah. Okay. The real story, not the interview story.
Not the school interview.
Not the school interview. I like real, people.
Okay, I'll be candid.
You're already there. You got the job. It's okay.
That's true. I was 12 years old, and I was I went to the orthodontist. I had my braces, and every time I would go to the orthodontist, he had a really nice watch.
Yeah.
He had beautiful women working in his office, which I appreciate as a 12-year-old.
Yeah. And you probably didn't notice it a few years before, but that year, yeah.
Correct. Around that age, I appreciate that. And I remember every time we would try to, at least this way, I remember we would try to book an appointment. He would say, "Oh, I'm going on vacation," or "I'll be in the Caribbean, I'll be in Europe," or this and that. And at some point I was like, man, this guy has a nice watch. He's got pretty women around him, and he's always on vacation. And then he has assistants doing the work for him. Yeah. So as a 12-year-old, I was like, that's what I want to be. I want to be an orthodontist. That's a true story.
You were smarter at 12 than any of us that went to medical school, unfortunately. You had it figured out.
I had it figured out.
Yeah, they're
of course,
not
what
open
I do
on
now
Fridays.
is completely the opposite.
Well, then you went left.
Yeah, exactly. Then my common sense went out the window.
It's okay.
But yeah, it was funny because it was that determination, and from then I didn't look at any other career. I went all through middle school, high school, thinking I'm going to go become an orthodontist. Yeah. And then when I got to dental school, at Columbia, I fell in love with learning medicine, and I fell in love with surgery, and everything changed.
I feel like that's the thing, is either you love surgery or you don't. And if you love it, you can't do anything else. You're like, this is amazing. Do you know what you did today? That was incredible. Yeah. So that's what I tell the med students. It's like, you're going to love it or not.
That's true.
If you're hungry.
There's no in between.
There is no in between.
That's very true.
And you have to be that way. I think you have to be that way to do the training and to...
Yeah, it's a job you have to love.
You have to love.
It's so demanding, and there's so much responsibility.
Yeah, all the stress and,
And there's a lot of stress.
It's their face. It's super important,
Definitely.
My significant other we were talking about earlier, he worked in ortho before working with me, and we would joke, we're like, at least we use our like skills for good, because the things you like to do, you're like, that's, if you think about it a little bit too long,
Right.
No, because you're doing it to help people. Like, you like surgery because it's its whole own world.
It is. Yeah, that's fascinating. We're lucky.
Absolutely, to be able to do this every day.
Mm-hmm.
Awesome. So the job brought you to Houston, or what brought you to Houston?
The job did, yeah. So I did fall in love with orthognathic surgery. We did a lot of that in training at Columbia. And at Houston Methodist, it was a really unique opportunity to jump right into an orthognathic. But I had a very different picture, a naive picture of Texas. And I remember coming to the medical center and being blown away by the amount of healthcare resources that I experienced, and especially coming from New York and New York Presbyterian, and you just think that that's the holy grail and it's got everything. And then I come and I was like, wow, they have. I remember at the time at Columbia, New York Presbyterian, they had 1 or 2 Da Vinci robots. And then touring at Methodist in their research, at Mighty in their research department, hanging out like in the corner somewhere, not being used. They had like 5 of them.
Right. They're like, oh those are the extras.
For training.
Yeah, for training.
And I was just like, wow, this is just a different level.
It's amazing. The Med Center is pretty incredible. I didn't know, because I like trained here the whole time, and you go interview other places and you're like, oh, well, we have this and this and we have this and this. And you're like, oh, well, we have everything like all together.
Yeah, that's true. I can't imagine it flipped around.
Yeah, where you go other places and you're like, you don't have
looking elsewhere.
Yeah.
I never thought about that. But especially, did you go tour New York?
Yeah. And I had a different idea of what that looked like. Right. I was like coming from Bintop, like this is going to be like 10 times Bintop. Like some places were crazy, and then other places were like, it was like smaller than what I thought.
Yeah. Real estate's an issue.
Oh, yeah.
I remember the recovery rooms are, they're like 1 bed here, 1 bed right there.
Yeah. It's tight because it has to be.
It has to be. Yeah. So.
So what do you think of Houston now that
I love it.
Been here?
Yeah, I love it. I can't imagine a better home base.
Yeah.
I think things I enjoyed in both New York and LA are the diversity, the food and culture, and just access to worldly type of events. And I feel like we have all of that here in Houston, and then the benefits of a much easier lifestyle, more affordable. Right. People are really nice.
They are. People are great. We have to stop telling people because they keep moving here.
It's terrible. You're right.
I know. Stop saying.
Yeah, actually, I take it back. Don't move to Houston.
No, it's great. I love that it's so diverse. That was the thing I loved about it the most. So going from employed to now with your own practice.
Yep.
So tell me, what made you decide that? How has that impacted your life? Yeah. If someone was thinking about doing that, what would you tell them?
Yeah, so I'll start with that. Do it. If you're thinking about it, do it. No, I mean, I came out of training and I was employed by a hospital system, and for 9 years, and it was a great place to start. I think being in the Med Center in an amazing institution with a lot of resources gave me a real good access to talented mentors and resources, and great major cases. Yeah. But at some point, there are limitations to being in an institution in terms of growth and the ability to get your own support system and resources to meet demands of a growing practice. I felt like that started to become an issue just because their focus can't be on individual doctors. It's more focus on treating a system. I mean, the interesting thing for us as surgeons is it's really an individual practice, right? It's like you have a practice that's so unique to you as a plastic surgeon that there are very few surgeons that have anything that's parallel, right? And I think that's true for most surgery.
Yeah, we're all different.
We're all different, very different, and have different styles and needs. And I did feel at some point that there was a conflict between what I wanted to do and what kind of support I wanted for my patients, and where I wanted to go in terms of growth and the ability to do that. So decided to leave about 3 years ago and start a practice, and it was scary for sure.
So you were like 2021? What year was it?
21.
Yeah.
Yeah.
Okay.
21. It was scary, and we're never trained in that.
Oh no. None of that.
We didn't really get that business or
No.
entrepreneurial education. So it was a huge learning curve. But it was fascinating. I learned so much that first year, and I'm still learning a lot every day. But I think that I've grown a lot from it, and it was worth all the stress. And now the things that I really wanted to get out of being a private, in terms of, adding support services to my patients and resources, and having the style and brand and entire culture and mission that matches what I want. Right. It's night and day different. It's completely different. It's more customized and individual, and it's been a blessing. And I definitely encourage anyone that feels strongly enough or at least has an interest in doing it to, reach out to people like you and I that have done it and find your mentors and do it, because you'll be able to become a better doctor, I think.
I think so too. Because like you said, you can provide care the way that you think it should be provided and do the things for the patients that you want them to have, you know. Anything you would have done different?
Yeah, I would have done it sooner.
100%.
I would have done it sooner. Other than that, I've been really happy with the decisions that we made. I mean, things have worked out better than I could have imagined or envisioned or hoped for. And it's fun. I've learned a lot. And now, it just opens up the door to what's possible.
Oh, yeah. It's wide open. I feel like in medical training, it's more structured thinking, and then you get into the entrepreneurial world, and it's just wide open. Like you can do anything.
It's
really,
so different.
And changing your mindset of, this is how you do it to how do you want to do it?
Right.
Whatever you want to do.
Yeah.
You can structure any deal the way you want it to, or build whatever you want, or whatever.
Right. Yeah, it's interesting. We have a fellowship program also. We do one fellow a year for a year. And our new fellow just started this month. He's from Columbia also.
Oh, yeah.
No bias there.
Of course not. He's good people, so it's
yeah, exactly. I know he's great. But it's fun hearing him talk about like, wow, when we're in residency, we never thought a practice like this is possible. Right. We thought that you can't do major cases without residents and this resident system. But obviously you have better resources for the patient and better care, and this is just not something that's possible. And hearing him say that, it's like, oh yeah, like I'm far removed from it, and there's a lot of things we take for granted of where we are, but I look back and this is not a practice that I thought was possible.
Yeah, especially as
a
trainee,
right?
That this is all you've seen, and that's all you know.
That's all you know.
And I feel like they kind of poo-poo the private practice a little bit
they
too.
Do,
like, you should go into academics, and that's the best way, and this and that, And I have all these theories about these things.
Yeah.
They don't teach us the business because then we don't negotiate our contracts when we go into employment, and we don't know like the economics of it to be able to do that.
There's
better.
a lot of power loss.
Yeah, and it's. At least for me, whenever I came out, it was more like, well, you should be glad you have a job, And I'm like, well, I've been grateful for 14 years.
Right.
I should get a little bit back at this point. Which
that's true. And the system is, the way it is, it's just developed where the people that run the businesses, the bigger corporations, there's a clear advantage over the doctors.
Yeah, and we don't get that training, and they're sure not going to give it to us. Why would they do that?
Why would they?
That's not in their best interest,
right.
really.
That's very true.
So I try to grab every resident and med student and fellow and be like, here, let's sit down and talk.
Yeah, exactly. There is another way.
I'll come in the OR, and I'm like, let me give you as fast as I can, as much as you can.
Yeah, exactly.
Because you may not get this anywhere else, but I want you to at least hear it. And, and how to like build a business and scale a business. Because at the end of the day, what do you have,
Right.
And do you have something you can sell? Do you have something that's worth something? Or do you just have a job? Or,
Right. It's true.
I feel like no one ever talked about that.
Yeah. And, it's a huge liability in terms of life. Like we sacrifice. I think people that are not in medicine, it's hard to appreciate how much goes into getting to where you got to.
All of us.
Or all of us,
Yeah.
but it's tremendous. I mean, you give up your youth, and doctors work really hard to try to be great and get to their patients. And I think a lot of that's not really appreciated for people that are outside of it.
It's hard to put your mind around that. Like, okay, well, you gave up your 20s, and for lots of us, that meant having kids later, and giving up that part. And there were social things that were definitely delayed in lots of people. So you can see that, I think, in personalities sometimes. And the delayed, like my sister she's awesome and super smart, but she got her degree, she went out, she started working, she didn't have the debt, she was able to start investing early, she was in
they're years ahead
10
easy,
and we're like, I have 6 figures
and
of
it's
debt.
hard it's hard to ever catch up, to be honest.
It is
everything compounds and things are vested, and it just gets it's very difficult to catch up, and especially for the amount of work that goes into it. That's why you have to love
it.
Job.
Yeah, you have to be like, I really can't do anything else. And I would joke, I'd be like, I have no other marketable skills, because it's kind of true and kind of a joke. Like, this is what
this is who you are.
Yeah, this is who I am. And I think it's part of your identity. It's like, this is who I am. And I think probably our generation and maybe younger, we're a little bit better about that being a little bit more diverse.
True. There's more discussion about it.
Yeah, of that can't be all of your identity.
Yeah.
It's definitely a big part of mine, but it can't be all of it.
True. Yeah, because what happens if
what happens
if
you can't practice, or you get to the end of the road and you're like, I mean, I can't stop.
Exactly.
I want there to be an end point eventually. Or so you can go on the vacations, and I want to be that person, be like, I'm on vacation. Be like
that orthodontist that I wanted to be in the beginning of all this.
Yeah, exactly. There's vacations, and there's this, and there's that, and, and be able to be there. For me, like, all my planning is around, okay, I want to be able to be there for my kids when they're at these ages, and this is the plan, and and I know we'd talked beforehand. You have kids too.
Yep.
So, what advice, I guess, would you give to people trying to be the parent and the surgeon and the business owner and it never ends?
Yeah, it's really difficult. It's really difficult because, for me, I want to be there as much as possible with the kids. And then I also have this value in that I want them to be proud of me. Yeah. And I think that's important for children to be proud of their parents. So that drives me to work harder and be a good role model in the community and successful in all those things, and dedicated and determined. I think that I want them to learn from that. But there's a conflict there between seeing them personally and giving a lot of time and having the ability to establish that.
Yeah. It's a constant back and forth.
It's a back and forth.
Yeah. There was Parent-Teacher Day that I found out about like 2 days ago. And I'm like, well, tell me how it goes.
Right. Yeah, I know. You're probably booked out 6 months.
Yeah, I'm like, well,
can you
that's
be here?
been booked. And like, at 9 o'clock in the morning, not really. You know?
Yeah. I love we have like dad coffee day or something.
Oh, yeah.
It's like every, I don't know, week. There's a weekday where you meet at 9 a.m. to have coffee with the teachers. But I can't do that.
No, that's never going to happen.
That's not going to happen.
And exactly, I need about a 6-month window beforehand so I can put it on the schedule and block it out, and then threaten my staff, do not block over this.
Exactly. Exactly.
Because they'll be like, well, this patient really wanted. And you're like,
right. Yeah. Okay. Exactly. Maybe 5 a.m. We can make it happen.
Super early, a little bit late, but not too late because then I get tired.
Exactly. So it's tough. I mean, there's going to be sacrifices.
Yeah. But I agree. I think it's good for them to see like their parents hardworking and, in the community and doing things for other people and, giving to other people. Because I feel like, that's what we do is we help other people, and that's what I keep telling my kids. Like, well, what is this? What do you do? And I'm like, well, we help people. Right. We help people look better and feel better. And,
that's a beautiful
thing. As much as we can describe it to kids,
Right.
what that means. So what's in the future? What does the future hold for you?
So we started seeing consults in Miami, LA,
Nice.
and New York. And
Oh, that's awesome.
I did it because I love those cities.
Yeah.
And I wanted an excuse to visit
Yeah.
more often, like, actually put it as a routine.
Yeah.
That's the way it, the idea came out. And I started with New York, and I loved it.
Mm-hmm.
I loved it. And then I added LA and Miami. And it's been wonderful. It's been wonderful to have a consistent schedule to go back to these cities on the weekends.
Yeah.
And the response from the people there has been great. There's a lot of interest, and we see a lot of consults there. We bring the patients to Houston. But I think...
So you consult there and then have surgery here. Oh, okay.
Yeah. And then I'll see a lot of the follow-ups when I'm back, since it's on rotation. So they're here for surgery, but it allows some touch points in there closer to their homes, and it's fun for us. But I think having a greater presence in these cities, and we'll see what happens.
That's awesome.
From there. It's been fun. Something that I never thought was possible.
Yeah, that's not going to happen as an employee.
Right.
Pitch that to your employer.
That was
like,
not a possibility. Yeah. So it's neat. And that's been a lot. It's done a lot for our growth.
Yeah, absolutely.
As a provider, and I've learned a lot from it, but also obviously from a business standpoint, it's been great.
Yeah. So how do you enter a new market like that? Like, what was your plan, and how did you?
Yeah. So actually leveraging social media. So there's no real marketing or paid marketing.
Yeah.
We'll just communicate with our community on our stories and say we'll be here.
Yeah.
And people will message us and say they're interested. And we've been able to fill up the schedule and even have a waiting list every single time.
Yeah.
Just from announcing. So, I mean, it's amazing how powerful that tool is.
Yeah, it is. And you do it very well.
Thank you.
It's awesome how much you can do and how you can reach people and communicate and and it's not thousands on paid ads that don't do anything.
Correct. It doesn't really, it costs time and resources, but it's not actually paid.
Right.
And the reach is amazing. Think about when I started the practice, and we worked with a traditional marketing company, and their focus is on making videos, like educational videos on our website. And they're so limited because you have like one little video explaining a procedure, and that's all the information. Then people have to go to the website to get it. And it's like, now I'm giving information almost daily in different clips, and the patients are coming and they know everything.
Oh yeah, they're educated.
They're so educated, and it's like it's working. They're learning from the discussions we're having on social media, and they're more informed, and it's making the consults a lot easier.
Exactly, because they're like, oh yeah, well I saw, and it's this and that and the other. And
right.
Like, okay,
yeah. And someone will say, like, I'll say, do you have any questions? They're like, actually, I've seen a couple hours of your interviews and content, and you've answered everything.
Yeah, it's great. So it's just time invested,
Exactly. Yeah.
I used to think it was a little weird when people would say that, and I've kind of gotten used to it, I guess. When they're like, oh, I've watched it, and you're like, really?
I know. Now you're like, yeah, it's great.
Yeah. Yeah.
This is good.
Oh, well, thank you for coming.
You're very welcome.
This was so fun.
This was fun.
And so if you like this, please like, share, follow, and you can find me at www.drangelaSturm.com, and then let us know where they can find you.
Yeah, it's alfioralsurgery.com or dr.davidalfi on social media platforms.
Well, thanks.
Thank you so much for having me.
This was great.
Yeah.